Preliminary feedback about PDMonitor comes from clinical studies, but most importantly comes from real life. We have more than 500 patients who have been using the device in the last 2 years, and it shows, the evidence behind that shows directionally, we still need to validate things, we still need to make sure that the hypothesis we're testing and the preliminary results are valid. It shows, first of all, that the vast majority of the patients find it easy to use. It shows that a big majority of the patients also use the mobile app, which is not self-intuitive because these are older patients that are not so familiar with smartphones. It also shows that patients are doing better or are stable through time, the majority of patients. Now that is actually a major breakthrough because this is by nature a neurodegenerative disease, so you would expect the patient to become worse through time. Preliminary evidence shows that a small minority of patients get worse, whereas you would expect most of the patients to get worse. And on the contrary, most of the patients are either stable or getting better. We still need to validate that, but this makes us very enthusiastic because it's a major breakthrough in the management of the disease. There's a number of reasons why PDMonitor is actually a major breakthrough. First of all, it supports a paradigm shift in the course of global pandemic. The numbers are really skyrocketing, patients expected to double. And it's a case study of digital transformation and digital care at home. This on its own is very important because there's a global trend to take the patient out of the hospital, keep them at home, and then at home optimize and manage these type of diseases. Now, Parkinson's on its own, despite the fact that it doesn't affect too many people, still is a very costly disease, and also a disease with no cure. So this costly disease is now possibly managed by a technology that helps possibly save cost, possibly improve quality of life, possibly improve the life of the people around the patient, and that has a global impact associated with the high cost of the disease. We are actually very emotionally satisfied by the fact that this is a technology that people adhere to, people like it, and people see the benefit. So we see patients saying that it has changed my life. We see patients saying, now I can communicate better with my physician. We can see patients saying, I can explain now better how I'm doing, and I can communicate with my physician in a way that helps me become a better patient. So overall, we see a great causality effect between streamlining of the medication, improvement of the quality of life, improvement of satisfaction, and essentially having the patients lead better lives. This is what keeps us going, and this is what makes us very excited about PDMonitor.
I think in terms of the paradigm shift of our management strategy, in Parkinson it will be very novel. However, such paradigm shift is already occurring in many other conditions, diabetes for instance, some of the cancer management, some of the other chronic neurodegenerative, chronic long-term conditions. Management is now often focused on management of the patient at home. Epilepsy is another example where home monitoring is becoming increasingly relevant and important. And I think this is going to be the situation with Parkinson's. As neurologists, we have been very conservative. We still feel that face-to-face examination is the ultimate strategy of care and quality standard of care. However, we have to also think about the patient and the carers, people who might live far away, and some of them who might be making a travel for 3 to 4 hours for a 20-minute consultation. In such case, the ability for us to monitor how they are at home, the ability of the patients to report back and to look at their own symptoms And the ability for us thereafter to manage the symptoms by treatment changes is a tremendous advance. And I think once this is evaluated in all the regulatory manner, there is a real chance that this will be incorporated in standard clinical practice.